Hello, thank you for tuning in. This is Dr. Tina coming your way once again with a short video about urinary tract infection. Today we're just going to discuss about urinary tract infection. What is it about and what does it mean? So urinary tract infection is an infection that affects our kidneys, our bladder, any pathway of the urinary tract. And so over here I have a definition, evidence-based definition, which says urinary tract infection is an infection in any part of your urinary system. Your kidneys, ureters, bladder, urethra, all those things can be an infection that has occurred over there, and it's termed UTI or urinary tract infection. It tends to affect women mostly compared to men. And some of the symptoms that one will feel that, oh, I have infection going on, something is wrong with me, is a persistent urge to urinate. You feel like you want to go to the bathroom every time. And also burning. You feel some burning sensation in your vagina or your urinary tract and down there. And so those are some of the symptoms. It also, your urine appears to be cloudy, and those are some of the symptoms as well. Sometimes you pass frequent or small urine, like you want to pee, but it's just little, comes in little. All those are some of the symptoms that occur with urinary tract infections. Sometimes the urine will appear red, bright pink or color colored, and those are some of the colors you find of your urine if you have an infection of the urinary tract infection. Sometimes you feel pain in the pelvic, in women especially, and around your pubic bone. So sometimes you complain about that. Also, sometimes you complain about back pain, and those are some of the symptoms that we have when we have urinary tract infection. Other common symptoms that one can complain of are some of the things I've already stated, like the back pain, flank pain. Usually they will say this side, and when you check, it might be where the kidney is situated. Those are called flank pain. And high fever, they have high temperature going on, shaking and chills are some of the symptoms, and also nausea and vomiting can be some of the symptoms that they have. The part of the urinary tract that is mostly affected is the kidneys, and is termed acute pyelonephritis. It's very important to know about this. Other site which affects is your bladder, and it's called cystitis, and also urethra. And that part which is also called urethritis. So those are some of the parts that you can have these, or the types of urinary tract infection that one can have. Something like the bladder infection or the cystitis, they mostly complain of the pelvic pressure, lower abdominal discomfort, frequent and painful urination, and sometimes tinge of blood in the urine. Some of the symptoms that shows that your bladder is affected. Urethra or urethritis, which is burning with urination. Sometimes you go to the bathroom and you feel some burns. Those are some of the things that happen with urinary tract infections, and also some discharges are some examples of that. So what do you do when you find all these symptoms? What do you do about it? One thing I urge you to do is to see your medical professional or your primary care doctor, and they will test you. We will just let you give us a urine, and the test takes a few minutes, and it will tell us if you have UTI. If you have that, then we prescribe you antibiotic. Sometimes it's very important to see your healthcare personnel, because it could be acute pyelonephritis, which affects your kidneys, and those are very dangerous, and so we don't want you to wait on that. So when you go and they test you, they can give you all these treatments such as antibiotic so that it will go away. What are some of the causes of UTI? Why do we have to have urinary tract infection? There is a bacteria in us, it's called E. coli. That's the short name, E. coli. And this E. coli, everybody has it. But then when they produce so much, they are the cause of these urinary tract infection. Especially, they are the #1 cause of UTI. And it's usually, this is located in our gastrointestinal tract. However, sometimes these bacteria are the responsible cause of the UTI. And so you can get it through sexual intercourse. Maybe you are not able to clean properly and you could get infected by that. And these urinary tract infection, which is the cystitis, are mostly sexual intercourse related because you are not able to clean properly and all that. And also the way women we clean, it can also lead us to have these infections. You have to clean from front to back. If you clean from back to front, you can have these infection going on. Another cause is infection of the urethritis or infection of the urethra. It's a type of UTI that can occur when your GI bacteria spread from the anus to the urethra. Like I said, the way you clean from front to back is the appropriate one, but if you clean from back to front, then you can have these going on. Also, sexual transmitted infections such as herpes, gonorrhea, chlamydia, mycoplasma can also cause all these urethritis. And these are gained through sexual intercourse. So just those are some of the main causes of that. What are the risk factors? If you are female, like I said, the way our system is made makes us being exposed to all these infections. Sexual activity, such as having intercourse with somebody infected with all these gonorrhea, chlamydia, all those kind of stuff, can also cause all these bacteria to lead to the UTI. Another cause is certain types of birth control can also cause someone to have that. Also, menopause can also serve as a risk factor. And so these are what I wanted to discuss. So if you have any issues with womanhood or vaginal itching or urinating appropriately, then I advise you that you seek your primary care doctor immediately so that they will treat you appropriately and on time. You have a good day. Remember to subscribe to my channel. Again, this is Dr. Tina. Thank you. Bye.